If you have kidney disease or chronic kidney problems, you need to be very cautious with supplements or vitamins that are usually considered safe. There are certain vitamins that can worsen kidney function or even lead to acute kidney failure if consumed in excessive amounts. People with healthy kidneys can generally tolerate higher amounts of these vitamins, but for those with compromised kidney function, excess consumption can be dangerous. Let me tell you a story about a woman, 55 years old, who thought she was doing the right thing by consuming large doses of vitamin C every day. Vitamin C is commonly known to boost the immune system and act as an antioxidant, so she believed it would be beneficial for her health. However, after taking 1,000 milligrams of vitamin C daily for months, she began to experience severe symptoms related to kidney failure. What she didn't know is that people with her condition should limit their intake of this vitamin. Over time, the excess vitamin C led to the formation of oxalate crystals in her kidneys, which caused blockages and impaired her kidney function. Now, let's take a look at the vitamins you should be careful with if you have kidney disease. Vitamin number 1, vitamin C. Vitamin C, also known as ascorbic acid, is known for its antioxidant benefits and for supporting the immune system. However, in high doses, especially in people with chronic kidney disease, CKD, it can become very dangerous. Excessive vitamin C intake can lead to the formation of oxalate crystals in the kidneys, increasing the risk of kidney stones or even acute kidney failure. In the case I mentioned earlier of the 55-year-old woman, she was taking 1,000 milligrams of vitamin C daily. This amount, which many believe to be safe, resulted in a rapid decline in her kidney function due to the accumulation of oxalate crystals. When the body is unable to eliminate these crystals properly, they accumulate in the kidneys and can block the flow of urine or cause serious damage. Kidney stones are one of the most common side effects of excessive vitamin C consumption. But for people with CKD, the consequences can be much more severe, including complete kidney failure. Therefore, it is crucial for people with CKD or pre-existing kidney problems to stay within recommended dosages and avoid excessive amounts of this vitamin. How to avoid these risks? Limit supplementation. For most people, getting vitamin C from natural sources, like fruits and vegetables, is safer than consuming supplements. Foods rich in vitamin C, such as oranges, strawberries, kiwis, and bell peppers, are excellent options. Consult a doctor. If you have kidney disease or chronic health issues, it's important to consult a healthcare professional before starting any vitamin C supplement. Moderate dosage. For those already consuming vitamin C, sticking to the recommended daily allowance, usually around 90 milligrams for men and 75 milligrams for women, is a safe approach. Vitamin number 2, vitamin D. Vitamin D is essential for bone health and plays an important role in calcium absorption. However, for people with kidney disease, especially those in later stages, excess vitamin D can lead to calcium buildup in the blood, known as hypercalcemia. This condition can cause various problems, including kidney stones, cardiovascular disease, and tissue calcification. For people with CKD, maintaining the right balance of calcium and vitamin D is crucial because their kidneys may not be able to convert vitamin D into its active form. Oversupplementation can cause a range of problems from nausea and vomiting to severe complications such as heart arrhythmias. How to avoid these risks? Monitor your levels. People with kidney disease should have their calcium and vitamin D levels checked regularly by a healthcare professional. Avoid self-supplementing. Do not take vitamin D supplements unless specifically advised by your doctor. Stick to the recommended doses and avoid excessive amounts. Use sunlight safely. For most people, moderate exposure to sunlight can help the body produce enough vitamin D. However, people with CKD should be cautious about relying too heavily on supplements and should always consult their healthcare provider. Vitamin number 3, vitamin A. Vitamin A is necessary for immune function, vision, and cell growth. However, it is fat-soluble, meaning that excess amounts can build up in the body and become toxic, especially in people with kidney disease. The kidneys help eliminate excess vitamin A from the bloodstream, but when kidney function is impaired, this process slows down, and vitamin A can accumulate to dangerous levels. High doses of vitamin A can cause nausea, dizziness, headaches, and in severe cases, liver damage or death. For people with CKD, even relatively small amounts of supplemental vitamin A can be problematic, so it's essential to be cautious with this vitamin. How to avoid these risks? Limit intake from supplements. It's better to get vitamin A from food sources rather than supplements. Foods like carrots, sweet potatoes, and spinach provide vitamin A in safe amounts. Consult a healthcare provider. If you have kidney disease, always talk to your doctor before taking any supplements, especially fat-soluble vitamins like A, which can accumulate in the body. Be mindful of preformed vitamin A. Retinol, the active form of vitamin A found in some supplements, should be avoided or minimized in people with CKD. Conclusion. While vitamins are essential for health, people with kidney disease must be especially careful about supplementation. Excessive intake of certain vitamins can worsen kidney function and lead to serious health problems. Always consult a healthcare provider before starting any new supplements, and focus on getting vitamins from natural food sources whenever possible. By being mindful of your intake, you can help protect your kidneys and maintain overall health. Vitamin number 4. Vitamin E. Vitamin E is a powerful antioxidant that helps protect cells from damage and supports immune function. However, like vitamin A, it is fat-soluble, meaning it can accumulate in the body if consumed in excess, especially in individuals with kidney disease. Oversupplementation of vitamin E can lead to a variety of issues such as nausea, fatigue, and even increased risk of bleeding due to its effects on blood clotting. For people with kidney disease, the body's ability to process and eliminate excess vitamin E is diminished, increasing the risk of toxicity. It is important to get vitamin E through dietary sources, like nuts, seeds, and green leafy vegetables, rather than high-dose supplements. How to avoid these risks? Stick to natural sources. Focus on obtaining vitamin E through diet rather than supplements. Foods like almonds, sunflower seeds, and spinach are great sources. Avoid excessive supplementation. Unless advised by a healthcare provider, avoid taking vitamin E supplements, particularly in high doses. Monitor your health. If you are taking any form of vitamin E supplementation, ensure that your healthcare provider is aware and have your blood levels regularly monitored to avoid toxicity. Vitamin number 5. Vitamin K. Vitamin K plays a crucial role in blood clotting and bone health. However, individuals with kidney disease, particularly those undergoing dialysis or taking certain medications like blood thinners, must be cautious about vitamin K supplementation. Excessive vitamin K can interfere with medications like warfarin, which is used to prevent blood clots. This interaction can make it difficult to manage the proper clotting balance in the body. For those with kidney disease, it's essential to manage vitamin K intake carefully, as the kidneys play a role in the regulation of blood clotting factors. While dietary sources of vitamin K from green leafy vegetables are generally safe, high doses from supplements can pose risks. How to avoid these risks? Consult your doctor. Always check with your healthcare provider before taking vitamin K supplements, especially if you're on blood-thinning medications. Stick to dietary sources. Leafy greens like kale, spinach, and broccoli provide safe and natural levels of vitamin K. Monitor medication interactions. If you're taking any medications that affect blood clotting, ensure that your healthcare provider regularly monitors your vitamin K levels. Vitamin number 6. Vitamin B6. Vitamin B6 is important for brain development, immune function, and metabolism. While it is water-soluble and generally easier for the body to excrete than fat-soluble vitamins, excessive amounts can still pose risks, especially for those with kidney disease. High levels of vitamin B6 can cause nerve damage and sensory neuropathy, which is the feeling of tingling or numbness in the extremities. In people with kidney disease, the body's ability to filter out excess vitamin B6 may be impaired, leading to a buildup that can exacerbate these neurological side effects. While moderate intake from food sources is generally safe, high doses from supplements should be avoided. How to avoid these risks? Avoid high-dose supplements. Stick to the recommended daily allowance, RDA, for vitamin B6, which is about 1.3 to 2 milligrams for adults. Supplementation beyond this level should only be done under medical supervision. Focus on food. Good dietary sources of vitamin B6 include bananas, chicken, potatoes, and fortified cereals. Monitor symptoms. If you notice any signs of tingling or numbness in your hands or feet, consult a healthcare provider immediately. Vitamin number 7. Vitamin B12. Vitamin B12 is essential for red blood cell production and nerve function. In most cases, it is water-soluble and poses little risk for toxicity, even in people with kidney disease. However, in some cases, excessive doses of vitamin B12 from supplements can lead to increased levels in the blood, which may not be well filtered by the kidneys. High levels of B12 in the blood can also interfere with certain laboratory tests, leading to inaccurate readings for kidney function and other markers. It's always best to get vitamin B12 from natural sources such as meat, fish, dairy, and fortified cereals, rather than from supplements unless specifically recommended by a healthcare provider. How to avoid these risks? Focus on dietary sources. Foods like fish, meat, and dairy products provide safe levels of vitamin B12. Consult your doctor before supplementing. If you are at risk of B12 deficiency and have kidney disease, consult with your healthcare provider to determine if supplementation is necessary. Avoid excessive doses. Stick to the recommended daily intake and avoid high-dose B12 supplements unless directed by a healthcare provider. By being cautious with vitamin intake and focusing on natural sources rather than supplements, individuals with kidney disease can avoid potential risks and complications. Always consult a healthcare professional before starting any new vitamins, especially if you have a pre-existing health condition like chronic kidney disease. Vitamin. Number 8. Vitamin C. Vitamin C is widely known for its immune-boosting properties and its role in collagen production and wound healing. It's a water-soluble vitamin, meaning that excess amounts are typically excreted through the urine. However, in individuals with chronic kidney disease, high doses of vitamin C can lead to the accumulation of oxalate, a byproduct of vitamin C metabolism. Excess oxalate can contribute to the formation of kidney stones and may further damage the kidneys. While moderate amounts of vitamin C from dietary sources like fruits and vegetables are generally safe, high-dose vitamin C supplements should be avoided by those with kidney disease. How to avoid these risks? Limit high-dose supplements. Stick to the recommended daily intake of about 75 to 90 milligrams for adults. Higher doses should only be taken under medical supervision. Focus on food. Foods like oranges, strawberries, bell peppers, and broccoli are rich in vitamin C and safe to consume. Monitor oxalate levels. If you have a history of kidney stones or are at risk of kidney damage, have your oxalate levels monitored by your healthcare provider. Vitamin number 9. Vitamin D. Vitamin D is essential for bone health, as it helps the body absorb calcium. However, people with chronic kidney disease often have difficulty managing calcium and phosphorus levels due to impaired kidney function. This can lead to a buildup of calcium in the blood, which can deposit in the heart and blood vessels, increasing the risk of cardiovascular disease. Additionally, excessive vitamin D supplementation can cause hypercalcemia, high calcium levels, which can be dangerous for individuals with kidney disease. It's essential to monitor vitamin D intake carefully and only supplement under the guidance of a healthcare provider. How to avoid these risks? Consult your doctor. Always discuss vitamin D supplementation with your healthcare provider, especially if you have kidney disease. Regularly monitor calcium levels. If you're taking vitamin D supplements, ensure that your calcium and phosphorus levels are regularly checked. Focus on moderate sun exposure. Sunlight is a natural source of vitamin D, but be mindful of overexposure. Foods like fatty fish, fortified dairy products, and egg yolks are also good sources. Vitamin number 10. Vitamin K. 2. Vitamin K2, like vitamin K1, is involved in blood clotting and bone health. While it is less commonly discussed, vitamin K2 also plays a role in regulating calcium levels in the blood and helping to prevent calcification in the arteries. However, as with vitamin K1, people with kidney disease need to be cautious, especially those taking blood thinners like warfarin, as it can interfere with the medication's effectiveness. Although vitamin K2 is found in foods like fermented soy products, natto, cheese, and egg yolks, excessive supplementation can lead to complications for those with compromised kidney function. How to avoid these risks? Stick to dietary sources. Focus on getting vitamin K2 from natural sources like cheese, eggs, and meats. Consult your healthcare provider. If you are on blood-thinning medication, talk to your doctor before taking vitamin K2 supplements. Avoid high doses. Only take K2 supplements if prescribed by your healthcare provider, as excessive amounts can increase the risk of calcification in blood vessels. Final thoughts. Be careful with vitamins if you have kidney disease. When it comes to vitamins and kidney disease, balance is key. While vitamins are essential for overall health, taking excessive amounts, especially in the form of supplements, can have unintended consequences. For individuals with chronic kidney disease, the body's ability to process and eliminate certain vitamins is compromised, making it crucial to monitor intake carefully. If you have kidney disease, it's always best to consult with your healthcare provider before starting any new vitamin or supplement regimen. Focusing on getting vitamins through a healthy, balanced diet is the safest way to support your health without risking complications. Key takeaways. Consult your doctor. Always check with your healthcare provider before starting any new vitamin or supplement, especially if you have kidney disease. Stick to dietary sources. Whenever possible, get your vitamins through food rather than supplements. Monitor your health. Regularly have your vitamin levels as well as kidney function checked by your healthcare provider to avoid toxicity or complications. The importance of regular checkups. For individuals living with kidney disease, regular checkups with a healthcare provider are crucial. Routine blood tests and monitoring of kidney function, vitamin levels, and overall health can help catch any imbalances early, allowing for timely adjustments to your diet or medications. Vitamins play an important role in maintaining health, but when kidney function is compromised, excess vitamins can accumulate in the body, leading to harmful effects. Your healthcare provider can offer personalized advice based on your specific health needs, and they may adjust your vitamin intake to match your body's ability to process them effectively. They can also help identify which vitamins are necessary for you and which might pose a risk. Steps to take. Stay informed. Be aware of how different vitamins affect kidney health and be cautious with supplements. Maintain open communication. Keep in touch with your healthcare provider, updating them on any changes in your diet, supplements, or symptoms. Prioritize a balanced diet. Rely on nutrient-rich foods that provide vitamins in their natural form. Fruits, vegetables, lean proteins, and whole grains offer a safer way to get essential nutrients without overloading your kidneys. Managing kidney disease requires attention to many aspects of your health, including how you take vitamins. Although vitamins are often associated with positive health benefits, for people with kidney disease, some can become dangerous if not managed correctly. From vitamin A to vitamin K2, each one plays a role in overall well-being, but imbalances can occur quickly in those with impaired kidney function. The best approach is a cautious one. Rather than taking over-the-counter supplements without guidance, work closely with your healthcare provider to tailor a vitamin regimen that supports your health while avoiding complications. Through careful monitoring and a balanced diet, you can help maintain your kidney function and overall health, allowing your body to thrive. This completes the detailed information on vitamins and their effects on kidney health. Let me know if you'd like any further adjustments or additions to the content. A simple vitamin that thousands of people take daily can be a silent killer. Imagine taking a supplement that you thought was safe, only to end up in the emergency room with potentially fatal kidney damage. This is exactly what happened to a 55-year-old woman whose story we are going to explore. If you're curious about how this happened and how to avoid the same mistake, keep watching. But first, I ask you to like our video. This will help YouTube understand that this is valuable information and will share this content with more people. Unfortunately, many people cannot afford health insurance, and in many states there is no decent public treatment. That's why it's so important for this video to spread across the internet. Now let's start. In December 2012, a 55-year-old woman suffering from kidney disease was urgently taken to the emergency room. She was extremely weak, with a very slow heart rate, noticeable swelling, and an alarmingly low body temperature of only 93 degrees Fahrenheit. Worried about a possible worsening of her kidney condition, doctors immediately checked her creatinine levels. The results were shocking. Her serum creatinine levels skyrocketed to 3,530 milligrams per deciliter, a significantly higher number than 2 months before. This indicated that her kidneys were failing rapidly. She was no longer producing urine, and her body was overloaded with toxic substances. As a result, she was urgently transferred to the intensive care unit and put on dialysis that same day. The medical team was intrigued by the rapid deterioration of the patient's kidney function. After extensive tests, they identified the unlikely culprit, a common vitamin supplement that many people take daily. They discovered that this seemingly harmless supplement was extremely harmful to her. It's not always the prescribed medications that pose the greatest risk. Sometimes, it's over-the-counter vitamin supplements. Specifically, there are 5 vitamins that can be particularly dangerous if not used correctly. Today, we're going to discuss the serious risks associated with certain vitamins for those with kidney disease. At the same time, avoiding all vitamin supplements can also be detrimental to kidney health. It's crucial to be vigilant about what you take. This incident is part of a broader pattern of hospitalizations caused by inadequate vitamin supplementation. Recently, a TikTok influencer developed kidney stones from taking vitamins to boost the immune system. Earlier this year, a 61-year-old man suffered terrible pain that was initially suspected to be pancreatitis, but was later attributed to his vitamin supplements. Another alarming case involved a patient who suffered from constant vomiting, severe leg cramps, and a dramatic weight loss of 28 pounds after just 1 month of taking excessive amounts of a vitamin, which ultimately led to the destruction of his kidneys. These stories highlight the importance of being well-informed about the supplements you use, understanding appropriate doses, and being aware of the risks involved. Patients with kidney disease are particularly vulnerable because impaired kidney function prevents them from effectively eliminating excess vitamins from their bodies, which can lead to dangerous accumulation, putting their kidney health at greater risk. Awareness and education about the proper use of vitamin supplements are crucial, especially for those with kidney issues. By understanding these risks and carefully managing supplement intake, patients can avoid potential health hazards and protect their kidneys from further damage. And if you are a regular viewer here, you should already understand the importance of being cautious with supplements, especially vitamins. Today, we will delve into 5 vitamins that present not widely known risks. Some of these can be harmful if taken in incorrect forms or doses, while others pose a risk to individuals with kidney problems. It's crucial to approach these vitamins with care. Let's start with vitamin number 5. I will begin with the least dangerous and move on to those with increasingly severe risks, arriving at 5th place. Vitamin D. This is a vital nutrient for kidney health, which may sound familiar because I have emphasized its importance repeatedly. However, it is essential to manage your intake carefully. Vitamin D is fat-soluble, meaning excessive amounts can accumulate in the body, potentially leading to complications such as hyperphosphatemia and hypercalcemia. Both conditions are serious and can cause arterial calcification. In some cases, high levels of vitamin D can even lead to acute kidney injury. To avoid these risks, it is recommended to consume vitamin D in moderation. The ideal dose is typically around 2,000 IU per day, combined with 100 milligrams of vitamin K2 and magnesium to prevent arterial calcification. This regimen helps maintain vitamin D levels safely. Sharing this information can be crucial for anyone with chronic kidney disease, so consider sharing this video and don't forget to like it to help spread the information. We have also created a detailed video about the relationship between vitamin D and kidney health that you can find in the link above and in the description below. It may be alarming to learn about the potential risks associated with vitamins that we need, but being informed is much better than facing the consequences of ignorance, such as kidney failure. Understanding these risks allows for effective protection of kidney health. Moreover, there is another vitamin that must be treated with care, especially in its synthetic form, as it can be potentially harmful. The fourth vitamin on our list of concerns is cyanocobalamin, the synthetic form of vitamin B12. Unlike its natural counterpart, methylcobalamin, cyanocobalamin is not derived from natural sources but is manufactured for cost-effectiveness. This synthetic version is commonly included in many multivitamins, making it widely consumed. However, its use can pose significant risks, especially for individuals with chronic kidney disease. Cyanocobalamin is known to contain traces of cyanide, a fact implicit in its name. While a healthy individual's body can process and eliminate these trace amounts of cyanide without issues, the situation changes when kidney function is compromised. In individuals with a reduced glomerular filtration rate, GFR, the ability to eliminate cyanide decreases, potentially leading to toxic accumulation and accelerating kidney damage. Research has indicated that the metabolism of high doses of cyanocobalamin can lead to the production of small amounts of cyanide for people with chronic kidney disease, which can accelerate the decline of kidney function. Therefore, those with kidney problems should be particularly cautious and opt for methylcobalamin. This natural form of vitamin B12 is safer for individuals with reduced kidney function and is generally recommended at a dose of 6 micrograms per day, especially for those following a plant-based diet. It's crucial to understand that vitamin B12 is poorly absorbed in its synthetic form, which leads manufacturers to package these supplements with large amounts of cyanocobalamin, sometimes 100 times the recommended daily intake, RDI. These elevated levels are intended to ensure adequate absorption but can also increase the risk of cyanide accumulation in people with kidney failure. Although vitamin B12 supplementation is vital for those following a renal diet to avoid deficiencies that can trigger a series of serious health issues like vascular disease and anemia, the choice of the correct form and dosage is equally important. The habitual deficiency of vitamin B12 can lead to significant health complications, making supplementation necessary, but it must be approached cautiously to ensure safety. Individuals, especially those with chronic kidney disease, are advised to meticulously check supplement labels to confirm they are consuming methylcobalamin and not cyanocobalamin. By doing this, they avoid the risks associated with cyanide while still reaping the benefits of vitamin B12, which is essential for maintaining good health. The third vitamin on our list of concerns is vitamin E, which in its natural form can be beneficial. It is considered a potent antioxidant, and antioxidants are increasingly seen as vital in managing and treating kidney disease. Despite these potential benefits, I highly recommend avoiding vitamin E supplementation unless specifically prescribed by your doctor. This is particularly crucial concerning synthetic forms of the vitamin. For those wishing to safely incorporate vitamin E into their diet, the best way is through food sources. Sunflower seeds, for example, are a nutritional powerhouse rich in natural vitamin E. Just 1 ounce of these seeds can provide up to 66% of your daily vitamin E needs, highlighting their value in a healthy diet. While natural vitamin E has its advantages, the synthetic variant, alpha-tocopherol, brings significant risks and should be avoided. Be especially cautious with any supplement containing high doses of this synthetic ingredient. Always consult a healthcare professional before adding any form of vitamin E to your regimen, especially if you have underlying health issues like kidney disease. The second place on our list is taken by vitamin A, which ranks high due to its potential dangers, even surpassing synthetic vitamin E in terms of risk to kidney health. This essential nutrient, generally beneficial, presents significant risks when ingested in large amounts, particularly for individuals with chronic kidney disease, CKD. For those with compromised kidney function, multivitamins containing vitamin A are not advisable. Common brands like Centrum, Smarty Pants, or Swissy, popular in Europe, are examples of products that may be harmful under these conditions. The problem arises because damaged kidneys cannot effectively filter and eliminate excess vitamin A from the body. This can lead to an accumulation of the vitamin, becoming toxic and causing serious health issues, including liver damage, birth defects, and accelerated deterioration of the kidneys. Vitamin A toxicity is most commonly associated with excessive consumption of certain foods, primarily fish liver. Although incidents of acute kidney injury from dietary sources are rare, they highlight the need for caution. Excessive consumption of foods rich in vitamin A, like certain fish livers, can lead to hospitalization due to acute kidney injury. This underscores the potential severity of vitamin A accumulation, emphasizing that even natural sources can pose significant health risks when consumed in large quantities. Furthermore, the levels of vitamin A found in typical over-the-counter multivitamins may be unsafe for individuals with a reduced glomerular filtration rate, GFR, a common issue in CKD patients. Because vitamin A can accumulate in the body, it is crucial for those with kidney deficiencies to manage their intake carefully to avoid toxicity and further kidney damage. The top spot on our list goes to a group of vitamins that are particularly dangerous when taken incorrectly, especially for those with kidney problems: fat-soluble vitamins. These include vitamins A, D, E, and K. Unlike water-soluble vitamins like vitamin C and B complex, fat-soluble vitamins are stored in the liver and fatty tissues, which means that excess amounts are not easily excreted from the body. This can lead to toxic buildup over time, particularly in individuals with kidney disease. The risks of toxicity from fat-soluble vitamins are heightened for those whose kidneys are not functioning properly because the organs responsible for processing and eliminating waste from the body are compromised. While these vitamins are essential for various bodily functions, the potential for harm is significant when they accumulate to toxic levels. For example, high levels of vitamin A can cause liver damage and exacerbate kidney problems, while too much vitamin D can lead to hypercalcemia, which can result in dangerous calcification of the arteries, kidneys, and other tissues. Even vitamin K, which plays a crucial role in blood clotting, can be harmful in excess, especially in individuals who are taking blood thinners or have kidney disease. Therefore, anyone with kidney issues should be particularly cautious about supplementing with fat-soluble vitamins. It's always best to consult with a healthcare provider before starting any new supplements, particularly those that are fat-soluble, as they carry a higher risk of toxicity. In conclusion, while vitamins are essential for overall health, it's important to remember that more isn't always better. Over-supplementation can be harmful, particularly for individuals with chronic conditions like kidney disease. The cases we've discussed today illustrate the dangers of indiscriminate use of vitamins, especially those that can accumulate in the body and cause harm. For people with kidney issues, it is crucial to approach supplements with caution and seek professional guidance to avoid putting their health at further risk. By being informed about the potential dangers of certain vitamins and making informed choices, individuals can protect their kidney health and overall well-being.